Host, Dr. Safiyya Shabazz, and here on the Her Health Matters radio show, we discuss topics that uplift the physical, mental, and social well-being of African American women. The program brings together experts and leaders in women's health and wellness, including doctors, nutritionists, community leaders, and elected officials. We provide valuable insights, guidance, and resources to help Black women make informed decisions about our health and wellness. For the next hour, we are going to be talking about the chronic condition of obesity with a board-certified obesity medicine physician, Dr. Alicia Shelley. Dr. Shelley helps busy people get started with their weight loss journey. And today, Dr. Shelley will be separating the hype from the truth when it comes to obesity. Is it a chronic condition? Is the treatment of obesity cosmetic medicine, or is it just good medicine? Today, we'll also have a patient perspective, as one of my dear patients has graciously agreed to join us and share her experience taking one of these new medications that's now available for treatment of obesity. As always, remember that none of the information that we share on this show should be considered as medical advice. Please consult your physician or other healthcare provider before making any changes to your personal healthcare regimen. This show is produced by Community Hero Action Group, a nonprofit organization whose mission is to close gaps in health and wealth disparities in the Black community with innovative and trustworthy initiatives and programming like this radio show. To find out more about Community Hero Action Group, be sure to visit communityheropa.org. Before we get into our Speak On It segment, diving deep into facts and fiction about the treatment of obesity, let's take a moment to get lifted. May, we're wrapping up the month with Memorial Day weekend, but it's Mental Health Month, and it's especially important to our community to raise awareness about mental health and promote conversations that can transform lives. We know there's a strong link between our mental health and our physical health. The stress and hardship we experience can make it difficult to stick with our health routines. And sometimes even stress hormones themselves can aggravate problems that we have, like high blood pressure, even blood sugar sometimes, and weight gain. Poor sleep that can be related to stress or mental health concerns can add to challenges that we have with our health, and even when it comes to maintaining a healthy weight. For many years, society has viewed struggles with weight as a personal failure, one dictated solely by your level of discipline and willpower, and people who carry extra weight can be ridiculed many times about their appearance, and this can really take a toll on your self-esteem. Please rest assured, this is not the conversation we're having today. This show is called Her Health Matters, and that is precisely our focus today, your health. But I was just struck last week by two things that inspired me to take on this topic. First was a study published in the Journal of the American Medical Association showing that in the last 22 years, Black Americans have lost more than 80 million years of life in excess of their white American counterparts. That figure was based on how many years were cut short from the lives of more than 1.6 million people who died before reaching a normal life expectancy in comparison to their white American peers. Looking at the causes of these deaths, the most common causes were cardiovascular disease, cancer, unfortunately assault, diabetes, and stroke. And we all know that the impact of violence on years of life lost in younger people is a special kind of public health emergency that for today is outside of the scope of our conversation, but all of the other top causes of our excess death are conditions commonly either caused by, made more likely by, or worsened by obesity. So we know that for very many years, there have been a variety of diet trends that have come and gone, but the numbers of people struggling with overweight and obesity have just gone up every year. And in recent years, a new category of prescription medicines primarily used to treat diabetes has now become available to treat weight loss. The medicines are pretty effective. They can be taken long-term for weight control, but then a lot of people are up in arms about it. So that was the second thing that triggered me. I saw a colleague post on LinkedIn about how a lot of employers don't want to cover these medications because they're expensive. I saw there were almost 100 angry comments about how people shouldn't be taking these medications just to look good, and how it's, causing a problem for other people who actually have medical conditions. And all I could see was the disconnect between everyone jumping on this Black Lives Matter bandwagon, but then when you actually have a tool that maybe could help to save Black lives, you kind of run into people's biases about who deserves treatment and who should foot the bill for these treatments. I couldn't help but be reminded about how the whole crack and heroin epidemic, was a crime problem, and policies to address the problem in the Black community varies by both the problem of drugs and the solutions that people came up with didn't become a public health concern until the face of addiction started to look a lot like an ordinary white person. So that that was like the stimulus of me wanting to have this conversation. And I know, as Black people, we have unique experiences and our perspectives about our relationship with food and body size and appearance and what it means to be beautiful. Those things can vary. But if we look at a more holistic view of health and take appearance out of it, I'm concerned about, what this plays, how this plays a role in management of our most pressing health conditions. So on that note, we have today's guest, Dr. Alicia Shelley. Thanks so much for joining us, and for the listeners, Dr. Shelley is a board-certified internal medicine and obesity medicine physician. She has worked for over 7 years helping people lose weight and maintain a healthy weight. Her ultimate goal is to help others achieve the ultimate best health. She is currently working at the Center of Best Health in Douglasville, Georgia. She graduated magna cum laude with a Bachelor of Science from Oakwood University in Huntsville, Alabama, and she received her medical doctorate from Case Western Reserve University. Dr. Shelley completed residency training at St. Mary's Medical Center in San Francisco, California. So she has been all over the United States gathering her expertise. Welcome, Dr. Shelley.
Thank you so much for having me. It's such an honor to be able to talk about this topic because this is major.
It really is.
So thank you.
I feel like you're a perfect person to have on and talk about this. As I mentioned, being a Black person and serving largely Black people, we see conditions like diabetes, heart disease, certain types of cancer that we know are related or can be made worse by carrying excess weight. And, these conditions, they not only impact someone's quality of life, but there are significant costs associated with it. And, the magnitude of the problem, it's estimated that about 42% of the population is obese, and even amongst children, about 20%, or about almost 15 million children have obesity. So, this is clearly a widespread health challenge. So, obviously it's a problem that many people want to know about, but I want to know from you, what's your story? What led you to become specialized in the treatment of this condition in particular?
Yes, so I actually have been one of those children. I actually had obesity as a child, and it was something that I dealt with, trying to improve my health, try to exercise more. And so my weight would actually fluctuate during childhood, teenagehood, even in college, also even in medical school. I think I got to my lowest weight in medical school, but then residency started, in terms of the stress of it all, and the weight just came back up. And so eventually after I got out of residency, I tried again to get healthy. Maybe now it's less stressful. But then I ballooned to my highest weight, and I knew I needed some assistance. And so since everything else I had done, it wasn't like I just all of a sudden was like, oh, let's go ahead and undergo bariatric surgery. It was like, no, I gave myself a whole year of trying, did anti-obesity medications, changed lifestyle changes. It just was not enough. And so I ended up undergoing bariatric surgery, sleeve gastrectomy in 2015, and was able to lose 80 pounds. Felt so much better. But as the years started creeping up, because the one thing we need to realize is that with obesity, it's a chronic disease. It's not cosmetic. There are many reasons why people gain weight. Sometimes it can be genetic, hereditary, it runs in the family. Sometimes it can be endocrine, with your thyroid, PCOS, neurobehavioral, if you're having depression, anxiety. These are things that can trigger obesity, immune causes. So there's multiple reasons why people gain weight. For me, it was a combination of medications and just genetics. And so even though I had the bariatric surgery, as I started to put on weight over the years, I was surprised, maybe about 4 years into it, that I was now had gained 40 pounds.
Wow.
So half of what I had lost. And so after that, I had to change. I had to be more focused on what I was doing. So I actually started with not only with more accountability, having not only a trainer, but making sure I was eating properly. I even actually started taking anti-obesity medications again, and it really helped me to be able to get down to the weight that I am now. And now I maintain it with different challenges, triathlons, marathons, things that kind of help me stay active, but it allows me to be able to be able to maintain the weight that I've lost. Because what I realized that this is a lifestyle. This is not, for me, it's chronic.
Right.
When I get off those medications or I skip a couple weeks, I start to see the weight trigger back up. And so for me, it's more of a lifestyle. If somebody has a history of high blood pressure or diabetes, no one would say anything about them being on medication to control it.
Not
and so
at all.
for me, no one have a problem with it. But for me, these anti-obesity medications help me to control my chronic disease, which is obesity.
That is really a great perspective and, really inspiring because you've been there. You don't like discipline. I mean, I think maybe I'm biased, but I feel like anybody that practices in this profession has proven they have incredible amounts of discipline. But you had all of the knowledge. You had the information, and yet that still wasn't enough to help you be able to overcome the condition without some actual medical treatment. So, the experiences that you shared, how do you think they have influenced your approach to the treatment of the condition when, you're not just managing yourself, but you're helping your patients to treat this condition as well?
It puts me in a unique position to kind of understand where people are, because there's so many different phases of, I would say, weight loss. And people, we go through different times, different episodes. Some days we're in the best, we're losing weight, we feel empowered, we feel good. And then there's other times when we just feel really down about it. We're like, man, nothing's working. Everything I'm doing is not enough. And so I've been there. I've been through the emotional roller coasters that people have. And so it helps me to have a different perspective on it. So when I speak to my patients, I'm speaking to them from not just somebody who's who's just, treating you on this. Somebody who's been through what you've been through, who understands. And sometimes people appreciate that. Some people don't. But, at least they can understand that I get where you're coming from, and let's see how we can move forward.
Right. It's funny because I would imagine that everyone would find that to be like your personal experience to be something that enhances theirs. But I mean, maybe there's some people who are like, you're not perfect either. I don't know.
It sometimes can be a little overwhelming because I found people where they've had questions and I maybe shared my story and then I never saw them again. So I was like, well, maybe I messed up with something that just threw them off. But, I just know that, I do my best to share and just to let people know that they're not alone. Sometimes we go through this life and we feel like we're the only person who's battling. Everyone seems to be thin and healthy and living life on Facebook and Instagram. And look at me, I'm not where I want to be. And so know that you're not alone and that we all are trying to get to a more healthier place.
Right. How do you think that cultural and social factors impact the ability of people, particularly from marginalized communities, to access weight management resources? I mean, that includes being able to manage themselves, like having access to healthy food or safe outdoor spaces or exercise facilities, and also access to medical treatment of obesity, like seeing a nutritionist or a doctor or getting medication.
It plays a role. If we look in our lower economic communities, what happens is there are not a lot of grocery stores with fresh vegetables. They're food deserts where you may have in your neighborhood a convenience store. And because it's not necessarily convenient to have fruits or vegetables, they're not stocking that because it goes to waste. It'll spoil before people buy it. So, your access to fresh food is limited. You have to drive miles away to get to a grocery store. Unfortunately, recently in this past year in Atlanta, there were just fires in the local Walmart and the local Target, all in the Atlanta area. And these were areas where people...
Seems like a weird coincidence.
Weird coincidence. Because the sad thing is, one of the stores that was closed down, they weren't going to open up again. They were like, oh, well, we're just closed for good. And so people in that neighborhood, if you don't have access to transportation or if you have to take the bus to get to work, now you're going miles and miles away to find fresh vegetables. It sometimes may not be convenient to your schedule. And so it makes it really difficult. I know I had a friend who lived downtown Atlanta. He's like, well, where am I going to go? I have to drive outside the city, the midtown city to get groceries,
Right.
So in those areas that are low economic, the food deserts are difficult. And what they do have is they have fast food. So they have your Checkers, they have your McDonald's, they have these all fast foods that are cheap. You can get a good meal for less than $5 where you feel full, but it's not healthy to help you live a healthier life. So that's one area where, in marginalized communities, where it makes a difference. When we think about our cultural stereotypes, in certain communities, it is praised to have more curves and more hips. Is actually looked upon. People are like, I'm dating myself, but the whole song, I like big butts and I cannot lie.
I was like, is it going to sound vulgar? But what started playing in my head was my anaconda don't want.
Exactly. This is just promoted, and it's not saying that it's not beautiful. Don't get me wrong.
But we're not talking about appearance,
We're not talking about appearance. We're talking about health. Right. So we want to be able to have a healthier lifestyle. Like you mentioned before, people are losing their lives because of their health and because they are having diabetes, they're having high blood pressure, they're having high cholesterol, and high cholesterol,
their body hurts.
If you're 40 and you're suffering with knee pain, back pain, that's limiting, and you're young. You still have the rest of your life to go, and now you're limited due to your exercise. Due to your weight. And so it all plays a role in how we can live a longer, healthier life too. Right. So that it definitely makes a difference as far as our cultural background and how we look at it.
Now, I wanted back to, neither one of us is getting, I don't think, getting paid by like a drug company, but I really wanted to talk about this controversy around these medications because, people are like violently opposed or, staunchly for this new category of medications. And I'm going to avoid calling any by name, but the category is called GLP-1 receptor agonists just because of the way they work. The more popular ones are like once a week injections that are taken, and it's basically the exact same ingredient that is in a very effective medicine for diabetes. So it kind of it helps to reinforce that there's a metabolic hormonal process happening that is playing a role in both conditions. When do you consider these medications for people? Like you talked about healthy eating and exercise and and even surgery. When do you consider medications like this for patients?
So I will, before I get to the indication, I do want to say one thing. I think the reason why people have become all up in arms is because we're seeing these celebrities who are already thin to start with, quote unquote, nobody's come out and said they're taking it, but have been rumored to take it. And so people are like, oh, well, now this is a problem. But the funny thing is that these anti-obesity medications, specifically the GLP-1s, actually came out years ago. Like the one that was a daily injection, that came out like 4 or 5 years ago. That's been on the market.
Probably longer than that.
Yeah, probably. Yeah, even longer than that with all the studies and research and things of that nature. So, but now it's just getting more traction because you have celebrities doing it, and there's a shortage on those GLP-1s too. And so when I look at my patients on who would be most, who would need it, definitely want to have a BMI of greater than 27, which would put them in the overweight category. Also, people who need a little bit of a kickstart. So when we look at studies that show with diet and exercise, on average, most people lose between 5 to 10% of their body weight. So if they've done like that over that 5%, it's a success. It's a success. And somebody else mind, they may not feel successful, but actually it is successful. But when you add on the medication for those who may need to lose more than that 5 to 10%, the medication, at least at the highest that we see in studies for the GLP-1 that's been FDA approved currently, it's around 15%. Now, there are some other weekly GLP-1 prescriptions that are being in the FDA approval process. And so those studies have shown that they're between that 15 to 20%, which kind of gives us more added access to allowing people to lose more weight. Because
so let's pause for a second, because people are afraid of math. If they we're not talking about something being on sale. So let's help people out here. So let's say you're 200 pounds. 5% would be trying to lose 10 pounds. 10% would be losing 20 pounds. 15%, what's that? We're at 30 pounds. Okay. Or losing 20% of your weight if you're 200 pounds would be losing 40 pounds. So that's kind of giving people a rough idea of like the 5, 10, 15, 20, because, unless something's going on sale, people are like, wait a minute, I need to try this. What's the price? Yeah.
And the one thing I would say, if you're trying to improve your diabetes or your high blood pressure, just losing that 5 to 10% or that 10 to 20 pounds is going to make a huge difference in your medical conditions.
Yeah.
So now we're making strategic changes in people's lives where we can maybe get off of diabetes medications, get off of high blood pressure medications, living a longer life where you have less of a risk for having a stroke and a heart attack down the line. Right. So we're getting to a point where we can really make change in people's overall health.
Getting to the root of why these other conditions are happening. So, but here's a really important question, because, once there's a medicine for something, there are certain people that are very motivated to make sure everybody's taking this medicine. But are there natural alternatives to these medications, like something that people can get naturally that works almost as well?
So there are some different remedies, home remedies, that people can try to kind of help reduce their appetite. I wouldn't say they're not necessarily as studied. So we don't have like that peer review that looks at, the natural herbal medication versus, regular prescribed medication to see the difference. But some of these are the things that my patients have done, and they felt like it really helped their hunger. So when we look at anti-obesity medications, what they do ultimately is that they help with not only curbing your appetite, but allowing you not to feel as hungry throughout the day, which can reduce how often you're snacking and how satisfied you feel when you eat. So with some of the herbal medications that I've seen in practice, anecdotally, it's going to be some apple cider vinegar and some water that kind of helps with curbing your appetite. I have patients who will drink like lemon water first thing in the morning. It kind of helps curb their appetite as well. As far as the ashwagandha, that's not quite as studied, so I wouldn't necessarily go there. But there are some other supplements that may help kind of curb that appetite so you're not as hungry. And there's some things that you can do as far as diets to kind of help reduce your hunger. For some people, eating a more higher in protein diet, because protein takes longer for it to digest.
Thing, a lot of people have found that to be helpful
too as well. There's many diets that are out there, but sometimes when you incorporate certain types of food, it does help.
Yeah. So, that is really, it's important for us to kind of keep the discussion holistic, and not just limited to one thing. But I'm going to be honest, I ain't never seen nothing like it. Except for like keto, actually, I feel like people could maybe make healthier choices in terms of the types of people have gotten like really dramatic results with that. But in terms of like supplements or whatever, like I never saw anything that seemed to be as effective myself. But what?
Me neither. But it's an option.
right. It's an option. But what are some of the like major challenges that you would say you run into when incorporating these medications into someone's treatment plan?
Yeah. So the biggest challenge is depending on where the person is. So some people have a lot of different medical conditions to start. And so they're coming to me because their cardiologist or their orthopedic doctor really wants them to lose weight in order to improve their heart conditions. And so because they're already on other medications, sometimes it's hard to want to get started on an additional medication to the whole list. So sometimes starting a medication is kind of difficult. The biggest challenge, I would say, is affordability and access, because our common like our Medicaid or Medicare, not all of these insurance plans actually cover anti-obesity medications. And so now this is when you're having to be a little bit more creative in how people can get it. And so that's where you're seeing people who are maybe diabetic or have prediabetes or insulin resistance being able to try and get some of these medications that are initially approved for diabetes to help with their weight loss.
I found it to be challenging with, private insurance and Medicare, but interestingly, here in Pennsylvania, like, as of January, they are covering some of these medications, which I was really surprised, but also really relieved because, it's definitely a population that's in need. This is a great discussion. I want to make sure that I'm reiterating to our listeners that all of the information on this program is reliable, but don't construe it as medical advice. Consult with your physician or other healthcare provider before making any changes to your diet or medication regimen. And if you want to call in, remember, you're listening to the Her Health Matters radio show. We are live at WURD Radio, 96.1 FM and 900 AM, and we're streaming on WURDradio.com. If you want to call in with any questions for the doctor, call 215-634-8065 or toll free at 866-361-0900. I wanted to shift gears a little bit because I had a patient who was very gracious in being willing to discuss her experiences. A dear patient of mine that I don't know if we have her queued up yet. Okay, this is Miss Jennifer Dobney. I reached out to her to ask if she'd be willing to share some of her experiences as a person who has had the condition of obesity, experienced some of the health consequences related to that, and also has firsthand experience with several types of treatments for obesity. So, Ms. Dobney, thank you so much. Welcome to the show.
Thank you. Thank you for having me on.
I first wanted to, again, thank you for being willing to share your story. You know, as a physician, I hear many stories, but I'm ethically and legally bound to keep them private or anonymous. So it's a special privilege for you to share this part of your personal health journey with the world, because I'm sure it can be helpful to other people. So would you tell us a little bit about how overweight and obesity has affected your health and the things you've tried to, address that?
Well, it started, the weight gain, I'll say, started with my hysterectomy in my 40s, which brought on the weight gain, as well as menopause, as well as high blood pressure. And so at that point, I tried the conventional ways of losing weight, the diets. Some were successful, but ultimately, I regained the weight. After that, I actually tried a lap band surgery. That, too, helped me to lose the weight. However, that band caused a constant vomiting. I couldn't live my life that way. I think it was called trapping, where the food wouldn't go through, and so I would vomit. So after that, I just resorted to healthy eating and some physical activity as a way to at least maintain, as opposed to gaining weight. And then we had COVID, and that just packed on an additional 20.
Right. And some people started off good, but as it dragged on for years.
So that's where it left me,
so,
with an additional 20 pounds gained.
So I know that, I was going to trying to figure out how to as you would like, but, one of these weekly medications that we were talking about to help to manage your weight. And I wanted you to share what changes did you notice when you introduced that to your regimen, in addition to the other things that you mentioned, trying to be more active and eat healthy and all of that?
Well, prior to, I had never heard of the medication, actually. And so when it was prescribed for me, I trusted the doctor's recommendation, but I went into the treatment with a low to medium expectation. So it's a 12, initially it was prescribed as a 12-week medication for me. I didn't recognize the benefits, or rather what was happening, until after the 8th week or so. And that's when I actually saw some weight loss. Until then, I hadn't weighed myself. I hadn't really paid much attention. And then, and it actually happened during the change of season. And I think what happened is that I went to put on some spring clothing and they fit differently. And that was the indicator. So at that point, I started paying attention. And I think I lost, after 8 weeks, about 9 pounds or so. And so then by the time I finished the 12-week medication, I had lost up to 15 pounds.
Wow. And did you notice any changes in other aspects of your health besides just the number and your clothes fitting better?
My blood pressure, which has always been a point of contention, and because it had been a problem, I would note what my blood pressure readings were, and they had begun to significantly be reduced to almost a point of normal
Wow.
readings.
That is really good to hear, like that point where, because that's the whole controversy. It's like, oh, people just want to look better, but we know heart disease is the number one killer of humans.
Mm-hmm.
Definitely number one killer of Americans, and the rates for Black Americans especially are, just there's a wide disparity where we're suffering from these conditions at a much higher rate. So I wanted to make that connection so thank you for that. But okay, you mentioned about the lap band and how you were having this trapping syndrome and vomiting. Have you had side effects from taking the medication?
Well, basically 2, maybe 3 that I would call noteworthy. That would be the mild stomach discomfort. And it's hard to describe it because it's not nausea. It's not really a pain. It's more of an annoyance, I'll call it.
Mm-hmm.
But it's enough to kind of distract you. And most folks, when they have a stomach ache or whatever, they don't think about eating. And so I think that, along with the decrease in appetite, I was, successful with the medication. It also caused me to be gaseous, which, that's okay. I mean, I live alone. There's only one other thing that I really noted, and that was low energy, a bit of lethargy. Mm-hmm.
Okay.
Yeah.
Now, have you made or found that in this, you mentioned like a couple of months process, have you made other kind of lifestyle changes that, and have you, once you started, like Dr. Shelley was talking about, getting a kickstart, have you found that to happen with other aspects of just maintaining your health, where you felt kickstarted, or incorporating other kind of lifestyle practices to help to maintain your results and the benefits to your health?
It decreased my appetite. I didn't want to eat. I have been able to incorporate intermittent fasting. I think it's the 12-8, where
Okay.
I eat within an 8-hour period and fast the other
Right.
Six-
You got
16
4 hours left over.
16-8. I'm sorry, 16-8, right? And that has worked well for me. And it's interesting, like even today, I got up and I had a cup of coffee and pittering around doing this and that. Around 12:30, 1 o'clock, when I'm supposed to eat something, it kind of was like an annoyance. Like, I don't really want to eat, but I need to eat something. I made myself a sandwich, and I was only able to eat half of that.
And, I mean, are you planning your meal so that you make sure you get the nutrition you need?
I am trying to be reasonable, logical, smart about things, and so, yes.
Okay. So I guess sort of like putting a bow on it, it sounds like from what you've said that you have a lot of experience, midlife, and maybe hopefully it's not like midlife, who knows, you could get to 120, maybe it's a third of life. You mentioned in your 40s how things kind of changed for you, and you had a couple of one surgery that seemed to trigger everything, and just the time course of events in your life. How would you respond to people who might say, you're, using up all of these healthcare resources for cosmetic reasons and just to look good, and, you're blocking this person from getting the medicine for their condition and theirs is more worthy than your condition, like what would be your response to that?
Don't feed into the cosmetic chatter about the product. You'll miss out on the purpose and the positive outcome that it can provide. That being, it's a safe and effective medicine for weight management. It lowers blood pressure levels. I've experienced it. And another thing that I've experienced is that my joints are no longer aching me, specifically my knee joints. I've taken off 15 pounds. That's 15 pounds of weight off of my knees.
So just like, you know, this is something, and this is the point, I guess, of me wanting to have this conversation, right? Because, you know, there's a lot of tools in the toolbox. You know, if none of us ever needed any medication, that's ideal, right? But you know, we need everything that's available to us. You need good advice. You need healthy communities and safe communities so that you can, you know, we need a clean environment and clean water and, you know, air that's not polluted. We need all of these things, and there's no one thing that works, but all of it together, you know, to get the best health outcomes. So, again, I'm really grateful to you to come and share your story and, you know, really provide, you know, I didn't know you had these skills to be able to so clearly describe, you know, how you have had a personal journey with your weight specifically and the things that you've tried. And I hope that by you sharing your story that you help someone else. I'm sure that there's at least one other person, and you know, we may have different faiths, but I know in my tradition they say if you save a life, is, I think that actually comes from the Bible too. If you save a life, it's as if you save the lives of all men. So I'm sure there's one that you save, so you can get your credit for all of them. So just before we kind of wrap up this Speak On It segment, I wanted to turn the conversation back to Dr. Shelley and ask if you can share with us some things that you're currently working on and how the audience will be able to connect with you after the show is over.
Yes, I'm a host of the Back on Track Achieving Healthy Weight Loss podcast, where we talk about things to help people with not only getting back on track, but helping them maintain their weight and kind of healthy tips and just strategies on how we can stay healthy, most importantly. And then also they can reach me at Dr. Shelley MD on Instagram and YouTube and TikTok.
Okay, so we got Dr. Shelley, MD, on social media. We've got Back on Track, the program. I forget what you said already. The
Achieving
website.
Healthy Weight Loss.
Achieving Healthy Weight Loss, yes, and the Achieving Healthy Weight Loss podcast. So thank you so much for that. I wanted to briefly touch on one other issue because I think it's really important, especially since it is Mental Health Awareness Month. And we know that there are people who suffer from eating disorders. So we want to try to keep like a balance the conversation, and or how would you suggest that as we're trying to help people to achieve a healthier weight, that we're approaching it in a balanced way where we're not adding to or making it more likely that someone might develop an eating disorder, even though we know that this is, you know, a condition that should be treated and, you know, and potentially help to affect a lot of other health conditions as well.
Yes. So, the interesting thing is that when we think of eating disorders, we think of somebody who's thin or underweight, but actually eating disorders, a majority of them happen to people who are larger size. And so it's important that we are more mindful of some of the different things that are going on. So the most common eating disorders that you see is going to be binge eating disorder, where after you eat, you may eat a whole lot, and you eat to not even the point of being full, but to where you're just stuffed. And then you may go and vomit, or you may go and do something else there, or you feel shamed after that. So you have the binge eating disorder, and with the bulimia, is when you go and you vomit the food afterward. And so for those who may be suffering with some of these symptoms, it's important that you seek help, and not just one person. A lot of times you need a multidisciplinary approach where you're seeing not only the specialist, the obesity medicine specialist, the nutritionist, the psychiatrist, psychologist, so that we can help you with kind of overcoming these eating disorders and actually living a more healthier life as well. And then also I would say sometimes with the eating disorder, it's hard to want to accept that may be where you are, but know that there are people and there's resources out there that can be able to help, and they can go to the there's the eating disorder. They can search for the eating disorder organization. I forget the name now, but there also is something called Project Help, which actually helps people because it can be somewhat expensive. So they actually have financial resources to help. Not Project Help, it's Project Heal, HEAL, and it can help people with getting financial resources so that they can get help.
Okay. I was trying to find it real quick when you mentioned that they do have a National Eating Disorders Association, and that could be a resource for people to use as a springboard to get help. So thank you. I wanted to make sure to include that aspect because, I want to be sensitive to the fact that, we recognize that there's many different ways that people can present with the condition of obesity, and they may be dealing with different things in the background that are related. Dr. Alicia Shelley, Ms. Jennifer Dobney, thank you both so much for having this important conversation. And I am sure that someone is going to be a little bit more informed and a little bit more motivated to address this aspect of their health, and maybe even also helping physicians or other health practitioners just have a different viewpoint on it. Sometimes we bring our own biases into the exam room, and that can affect how we're treating patients. So thank you so very much. We're going to move on now to the Policy and Women segment. And just on this same subject, I wanted to share how on January 9th, 2003, the Pennsylvania Department of Health issued a bulletin informing Medicaid providers in Pennsylvania that they added obesity treatment agents to the statewide preferred drug list. It also issued new guidance on the requirements for prior authorization, the type of information that's needed in order to determine whether it's medically necessary for someone to be prescribed an obesity treatment agent. So if you are a Medicaid patient in Pennsylvania who has not been successful managing obesity with diet and exercise alone, I encourage you to discuss whether you might be a candidate for medical treatment with your doctor or other healthcare provider. Lastly, as part of Community Hero Action Group's ongoing effort to build the block, we encourage everyone to be informed and stay engaged, which includes voting every 6 months. There's a primary and general election every 6 months. There are a lot of different policies out there from candidates that indirectly and directly affect women's health and wellness. I just mentioned one of them. And the last day to register to vote for the November 7th election is October 23rd. You can visit votespa.gov for more information to register to vote. And if you're already registered, you can check your voter registration status. So, in closing, I want to remind everyone that the producer of this show, Her Health Matters, is Community Hero Action Group. a 501c3 nonprofit dedicated to closing gaps in health and wealth disparities in the Black community. If you want to get involved with the work that Community Hero Action Group does, such as this radio show or many other health-related initiatives, visit the website at communityheropa.org or email us at contactus@communityheropa.org. It takes all of us to get the work done. On behalf of Her Health Matters, I'd like to thank the executive producer of Her Health Matters, Nicole-Keels McGruder, who is also the founding executive director of Community Hero Action Group. And I also want to thank WURD's technical producer, Ms. Rhonda Gibson. Thank you so much. That is all for this episode of Her Health Matters. I'm your host, Dr. Safiyya Shabazz, and I'm signing off today. Until next time, be healthy, be you, because your health matters. Peace.
Her health matters. Yeah. Our focus